Translational research is the most rewarding because it is going directly from the bench in the laboratory to the bedside of the patient. It is research that makes a real and tangible clinical impact that we can see the results and the benefits of in the outcomes for our patients. Why does preterm birth happen? It's a very complex question, and it's what we describe as multifactorial. So there are lots of reasons why a baby might be born too soon. Sometimes there's a medical problem in the pregnancy, the mother is very unwell, and we as doctors know that in order to keep the mother well, we actually need to deliver the baby. Sometimes, completely unexpectedly, a baby decides that it's time to be born. That may be related to problems with the placenta, bleeding in pregnancy, problems with the cervix, and there definitely is a role for infection. And that is the area that we're focusing on. The vaginal microbiome and the bugs that live in the vagina are very important in preterm birth. They are emerging as a very key part of the puzzle of preterm birth. So the PrePopStudy is a very exciting and new study where we are trying to see if a good bacteria that we have identified in healthy term pregnancies can be supplemented to women who are at high risk of preterm birth. So the question that we're asking in this research study is it possible to change the vaginal microbiome of a woman who is at high risk for delivering early by supplementing her with an oral probiotic? So the potential impact from this kind of study is actually huge. Preterm birth is a significant problem. About 15 million babies are born too soon every year around the world, and about 1 million are estimated to die as a direct result of being born too soon. Not only is there a higher chance of dying if you're born too soon, but there are ripple effects out into the family, wider society, economic effects, and for the individual child who was born too soon, there can be significant health problems later on in life as a result of that. So by researching and tackling this really common, really significant problem, we can actually have a huge effect across the lives of babies and their mothers and their family and wider society. So perinatal research is quite exciting because you get a big bang for your buck. This is not affecting just one disease or one person. Investment in perinatal research has huge ripple effects across the family, across the society, and into later life. If you have a good pregnancy, you're born on time, and you're looked after well in that critical time around your birth, you will most likely go on to have a very healthy and long life. So when you invest in women's health, you are really making a good investment in terms of your return. Please donate to the National Maternity Hospital Foundation. Your generosity will help babies to arrive, survive, and thrive.